Certain groups of patients are not very good candidates for total shoulder replacement that's done conventionally because of higher revision rates, loosening, and unsatisfactory results over time. These patients are actually the best patients for a few of the procedures I've been performing, such as the arthroscopic biologic total shoulder or the shoulder resurfacing. There are certain indications for each. Many of the younger patients are good candidates for either one, or again, highly active older patients. The arthroscopic biologic total shoulder is done with fresh osteochondral allograft. This is donor graft from a tissue bank. The tissue is size matched to the patient's anatomy off of x-rays, and then once the graft becomes available, we have about 10 to 14 days to do the surgery and use the grafts. With the arthroscopic biologic total shoulder, everything is done entirely through the scope. The largest incision is less than 1 centimeter, as opposed to a large incision with an open shoulder replacement. Also, with this procedure, the rotator cuff's not violated. You actually go between the rotator cuff or the interval. Everything is passed through the interval, and the surgery is performed minimally invasive. The advantage of using an osteochondral allograft for a shoulder resurfacing is that you're replacing damaged cartilage and bone with new cartilage and bone. This is the procedure that's closest to the patient's anatomy than anything we have to date. Also, the arthroscopic biologic total shoulder is the first shoulder replacement we've done entirely arthroscopically in history. The surgery is outpatient. It's done the same day as they leave the hospital. They start therapy right away. They start moving their shoulder. The arthroscopic biologic total shoulder resurfacing has actually only been performed for the last few years. There's a few surgeons in the country performing this and having good early results. For the arthroscopic biologic total shoulder resurfacing, the patients that I have performed the procedure on have done very well. They've gotten back to activities they weren't doing for several years.
Well, I can now do the ATM with no problem. So yeah, I can, before I couldn't raise my arm above here, above 90 degrees. Now it's all the way up here. I mean, no pain. Before I had the surgery, doing push-ups was very painful, and I really couldn't do more than a few of them at a time. And certain other exercises like military press and things I couldn't do either without either a lot of pain or else I could clicking and popping, and it was getting worse over time. So now I can do both without any problem.